I've had 8 pregnancies, and I've had 2 ectopic losses in that, and the others were very early miscarriages. So he was the only one who survived all of that. 1 out of 8. I count each one of them. Um, I name them, honor them, and grieve them. I am a gardener, farmer, um, herbalist consultant as well. I am a doula that's been trained at Uzazi Village. I was about 8 months pregnant. I had been studying, just like home study, self-study of birth, but I found I wanted to go deeper. This movement began before the 60s movement with all the white women. I started actually talking to my father about these things because he was like, my aunt was a midwife, she caught babies. Your grandmother was a midwife, she caught babies. And my great-grandmother, everybody here, they taught this to their daughters. This is the way your grandmothers and great-grandmothers and great-grandmothers birthed before their licenses were taken away by this medical system in the 20s, 30s, 40s.
I'm fighting for the humanity of these women, but I'm also fighting for the humanity of healthcare. I'm Hakima Tafunzi Payne. This is Uzazi Village. This is a nonprofit organization that I founded 7 years ago. If you look around the walls, you'll see images of Black families and Black breastfeeding moms. I've had extensive experience interfacing with the maternity care system, especially one here in our city. And it was those experiences and also my experiences early in my career as a labor and delivery nurse that led to my decision to found my own organization that dealt directly with how maternity care services are received by African American families. What I observed both in my experience as a birthing person and as a professional who worked bedside with birthing individuals is that African American women are often subjected to a very personalized form of racism in the healthcare setting as they birth their babies.
In July of last year, July 2nd of last year, I had a very traumatizing experience with a hospital in Kansas City.
If what was happening was what I thought was happening, it's actually life-threatening. And I thought she'd have the best chance of getting the best care at this hospital. And to this day, I regret that.
Gave me a recommendation for a hospital that had a maternal emergency unit, and I arrived there at 5 o'clock thanks to a wonderful friend that drove me to the hospital with my son, and he actually had to help carry me into the emergency room. I could barely walk. I was in so much pain. And when we arrived at the desk for the admissions, the person at the desk didn't even look at me. I was just I need help. I'm pregnant. I've had ectopic pregnancies before, and I feel like I'm having one right now. And he was just well, you can go wait over there. They told my friend that he had to wait outside. And he was well, she can barely walk. You want to get her a wheelchair? And they're no, she'll be fine.
My phone rings and it's her, and I think, oh yeah, I got to know what's happening. And she said, I just wanted to touch base with you. They're about to roll me back into surgery. And I said, oh, well, thank God for that. I'm so glad to hear it. But I said, It's 11 o'clock. You left Uzazi at 4 o'clock. It's 11 p.m. Why did it take them so long to get you back into surgery? And she said, oh, well, they just diagnosed me. And I said, well, what tests were they running prior to this, those other 7 hours? And she described the tests. And I thought, oh my God, they're drug testing her. Had a young black woman with locks in her hair. They just took one look at her and thought, surely this is a drug situation, and let her health deteriorate rapidly. Well, they ignored obvious signs.
They didn't take me into surgery until after 1 o'clock in the morning. And I can't help but think of so many people who've died from less.
And that happened on my watch, right under my nose. Right under my nose. Something I can hardly ever forgive myself for. Black women are simply not listened to. And so when they're not heard, when their voices aren't heard, and their words aren't respected, there are serious consequences to that when it comes to health outcomes.
With the coronavirus and COVID-19, it just revealed, put a microscopic lens on these disparities that we've already been aware of. And some people have had the privilege where they haven't had to know because it doesn't affect them. But it's a fear that too many people have known. And it's something that crosses class, crosses educational levels. You can be a celebrity, tennis player, and still, they do not listen to our voices. They don't think that we know our bodies. They don't trust us to have humanity.